I'd gone through major surgery for esophageal cancer, and 3 months into my recovery, I got an invitation from a researcher called Dr. Pam Ramsey to be part of a patient group that would help advise on the creation of this website. The whole idea that Pam had was, having looked into a variety of different websites, she thought they were all too complicated, not user-friendly, and too full of medical jargon. So the idea was to cut through all that and make it much easier for the average person to access the information in a way they could understand. It's called criticalcarerecovery.com, and once you discover it, you'll find that it's full of information for all aspects, not just for the patients themselves, for the relatives, and it makes your life so much easier when you're trying to find out what goes on both before your surgery or whatever reason you're in the critical care for, during your time, and even after and on your road to recovery. I think one of the biggest advantages is that there's so many questions you have when you're ill, and it's not easy to get the answers from reliable sources. The whole idea of this was just to say, look, we will give you reliable information. And this reliable information comes from really good sources. There really weren't any answers for the children on a lot of the websites we looked at. So we basically developed an area just for the children. I myself am on one of the videos on the website explaining about my journey through the ICU. One of the things we thought would be a good idea was to allow people to create an account and save information. So if they find something that's relevant to them, there's simply one click and you can save that information into your own area. That allows people to almost build up their own little book, their own little website within the website. Patients are being listened to when it comes to the creation of digital health websites and digital health platforms and apps. So the apps and platforms have become much more accessible, much easier to use, and in a way much more relevant to how we live our lives these days with the use of technology.